South Africa, 1 in 25 babies don't make it to their first birthday, and 1 in 322 women don't survive pregnancy or childbirth. Many of these deaths can in fact be easily prevented.
There are lots of mothers who do not take the baby to the clinic. She said he's scared to go to the clinic because the nurse will have attitude. The baby, you have a right to go to the clinic. Whatever the nurse, you have attitude.
We try to do our best, but the problem is that the community does not understand that. Communication with the community is a major problem.
My name is Brittany Bunce, and I'm the project manager for Black Sash's RMCH project. RMCH stands for Reducing Maternal and Child Mortality through Strengthening Primary Healthcare. In the RMCH project, we wanted to find out what is the best way that we can try to strengthen community health committees. Community health committees were set up to facilitate accountability between service users and service providers, and to also create a space from which communities can participate in health.
A clinic committee is to make sure that good governance in the clinic and to protect the staff and to protect the rights of the clients, which is the community.
Mina ngokwami kule yakithi iclinic sixhumene kakhulu thina belaphi bendabuko kanye nama clinic kanye nale clinic yethu. Uma silapha umuntu sinazi incwadi zokumrefer umuntu ukuthi akahambe ayotesta ayokwenza noma yini okusehlulayo thina uyahamba ekhona eclinic. Siyasebenzisana kakhulu neclinic yalakithi eBrandville.
For the RMCH project, we decided to pilot a community scorecard initiative. A community scorecard allows both service users and service providers to jointly identify what are the key challenges undermining maternal and child health and come across shared solutions from which to address these. We also set up an RMCH action group, which would be the facilitators of this community scorecard initiative.
I am a member of RMCH Action Group. So RMCH is going to be coordinating between the health provider and the service user.
This community scorecard initiative involves a range of different stakeholders, as well as the RMCH action groups, such as civil society organizations, traditional and community leaders, and government.
I-community scorecard mna ngendlela endiyibone ngayo ndiyibone into kokuba yi-tool efanele kukusetyenziswa ukusombulula iingxaki ezibetween i-community ne-service provider, that is i-clinic, because amaxesha amaninzi sikhombana emehlweni uzofumanisa uba i-community ibleyima istaff saseclinic, sibe istaff saseclinic sibleyima i-community.
The RMCH Action Group is a partnership between the local Community Health Committee and other civil society organizations. Jam, for example, is both a member of our RMCH Action Group as well as the chairperson of the Community Health Committee.
The community scorecard, to me, as Black Sash taught me, is the tool to monitor things. Now, the community scorecard helps the community to understand their rights and to understand their responsibility.
The community scorecard essentially involves 5 stages. In the first stage, planning and preparation for the scorecard is undertaken. This involves training of the RMCH action groups and recruiting people to come to the community and the facility meetings. In the second phase, the RMCH action group run a community scorecard with community members. They are invited to take part in a meeting where they discuss key challenges undermining maternal and child health, prioritize a list of indicators of what they want to see changed, and provide suggestions for improvement. During the third phase, the RMCH Action Group runs the same process with the facility staff and outreach health staff connected to that facility. They develop their own scorecard with their own list of things they want to see changed and suggestions for improvement. During the fourth phase, the facility and the community scorecards are taken to a multi-stakeholder meeting where facility staff, service users, and other stakeholders develop an action plan to address maternal and child health. The fifth and final stage involves implementation of the Maternal and Child Health Action Plan. All stakeholders are involved in implementing different aspects of this action plan, which was decided upon at the multi-stakeholder meeting. This stage also involves monitoring of progress. Ideally, this process should be repeated in 6 months to 1 year to measure improvements and identify additional actions required to address challenges.
These stakeholders will work towards achieving this goal of improving the services by involving the higher power, of course, from the government. That's what we're working on.
The Black Sash training program aimed to capacitate the RMCH Action Group to be able to facilitate a community scorecard process in their communities, to assist them in understanding what the roles and responsibilities of community health committees are and how best they can engage with government and with other stakeholders in their community to jointly address maternal and child health challenges. Simangele, for example, is the chairperson of the Bruntville Community Health Committee.
The Black Sash training helped me because some of the roles of the chairperson or of the clinic committee, I didn't know. I didn't know that I must know the budget of the clinic. And now I'll be more open eyes. I'll be more wanting to know, yeah.
The RMCH action groups were also responsible for mobilizing the community members, the facility staff, other health workers, and various other stakeholders to participate in the meetings.
I'm one of the mobilization. I'm also the community caregiver. It's easy because all the people really like me because I'm working in your house, then I'm talking with the people, I'm learning, I'm giving the education for the people. It's easy.
As a ward secretary, I work with other members of the ward committee. And once we were in a meeting with our ward council, I presented. I did the presentation of the RMCH action group, telling them what we're going to do, what we want to see in the future. Then I got the ward committee members to select the names from their villages, to select the people. So I found those people, telling them over the phone that they must attend this training or workshop or this community scorecard.
The next step in the process is to conduct the scorecard meeting with the community, whereby they identify the key challenges in terms of accessing maternal and child health services. These challenges are then prioritized and transformed into indicators or things we want to see, against which the status quo is scored.
The indicators were developed when the community gave their consent, and of course that has to be what we want to see in the future. How can we take this negativity and put it into positivity?
Those indicators were realistic because according to what the community was facing, it was a real situation which was happening.
Now I'm so happy because now sizokwazi uidentifya into kokuba kutheni abantu bengazisebenzisi inkonzo zekliniki kodwa bezazi into kokuba bazifelefele, and also sitsho sibone into kokuba ingaba yeyiphi indlela abasebenzi besebe lezempilo abangenzanga kakuhle, because now siyayazi into kokuba ukungayi kwabo eziklinik it's not mean abayinikwa information, bayayinikwa information, and bona i-community iyavuma yona ngokwayo into kokuba ngelinye ixesha bayayinikwa i-information but bona bafeyile ukulandelela imigaqo nemiyalelo abayinikiweyo ekliniki.
The change I want to see first, it's from us as mothers. We have to attend clinics, especially on our pregnancy period.
It's important to the community to speak out with the problems, because the facilitator don't know the problem of the community.
The next step in the process was to run a meeting with facility staff and other health workers, whereby we conducted a facility scorecard where they prioritized the key issues that they feel are undermining maternal and child health and came up with their own suggestions for improving this.
The service providers, at the beginning, they were like, they want to close the information. They didn't want to share the things. But they end up sharing the information. And now the service users, they were very happy to hear the information of the experience of the service provider.
About the staff scorecard, it was difficult today. It was difficult because ndizoyibeka ngokuthi mhlawumbi istaff sinayo into ba defensive, singavumi uadmita into kokuba benza wrong kwezinye indawo, though sibona into babanazo ii-challenges, like ii-challenges zongabikho kwe-equipment. Basho babeke ke izizathu zokuba kutheni bengaprovide ii-services ezi-right kwii-communities, because akukho equipment, akukho zi-consulting rooms ezoneleyo, and kwa istaff siyashota kwasona, abekho skilled nabasele beqeshiwe.
Nurses are especially used to being accused of bad services and poor attitude, but often this is due to factors that are out of their hands. They do need support and understanding from their communities.
Because at first it was as if we don't want to engage with the clinical committee because it was as if it was a watchdog. But now we know it's a link between the service provider and the service user, so we can engage with them for the best of the community.
The multi-stakeholders meeting, went well. We invited department, health and municipality, all the community leaders, traditional leaders and community members.
I'm working in the Department of Health, coordinating all programs at sub-district level. I think the stakeholders meeting today was quite interesting, as each one of the stakeholders has a role to play in service delivery, especially in reduction of maternal and child deaths.
The purpose of the multi-stakeholder meeting is to bring together all the stakeholders to come up with a maternal and child health action plan based on the indicators that were developed both in the facility and the community scorecard meetings.
In that meeting, we were able to agree on the action plan. It was a decision or solutions which were made as one group, not as individual, service provider alone, community alone, and also the NGO alone. It was a collective solutions.
We've managed to build the relations between the community and the staff members, because before we didn't bring them together. So now we've brought them together so that the community can raise the issues and also at the presence of the staff members.
I think the action plan is in accordance with the priorities of the Department of Health, because most of the indicators that are being addressed in the action plan are the indicators for the reduction of maternal deaths and children's deaths. The Department of Health is prioritizing maternal and child health.
One of the key aims of the Black Sash RMCH project was to build strong relationships between the community health committees and the communities that they serve, but also between other stakeholders interested in taking forward maternal and child health.
There are people in civil society, like your Department of Health and Seniors, your municipalities, your traditional leaders, your religious leaders, and other people. And those people make decisions and they are interested to help us, and they are supporting this program. They are supporting us as a clinic committee.
Ngiyabona ukuthi singaba khona inhlangano ekhona njenga omama nabakhulelwe nabasazokhulelwa, singasebenzisana nabo ama NGO nama CCG, siyasebenzisana nawo ngoba nawo ayahamba engene emzini yabantu, singasebenzisana futhi nawo kakhulu.
It is very, very important for the clinic committee to work with these organizations, because that's where the clinic committee will get the information it needs to work on, because it's there for the people.
In order to be able to monitor whether this community intervention has actually resulted in any kinds of changes, we would need to be able to monitor the process over a longer time. These RMCH action groups are empowered to take the process forward.
This was a pilot, but now we need to continue monitoring. We will do this program. We will monitor even if the Black Sash has gone. Department of Health, in order for us to continue with this program, we must support us in terms of in the budget.
People, of course, have to tell the department what's going on in the communities, as well as the Department of Health staff members have to tell the people what's going on at the department.
I want to thank Black Sash for opening my eyes and give me the knowledge and also the skill I got. Yes, I did have the skill for facilitation, but I didn't have that confidence. But now I can stand in front of the people facilitating.
My hope is that as a clinic committee and as the chairperson, I want to see the good relationship between the health care workers and the community. And that relationship is going to be built by us as a clinic committees. We are their mediators.
The things that I like to see in South Africa, no unborn children dying to their mother's tummy. Every mother should go to the clinic in time. No dying babies, no dying mothers after birth, because without mothers and babies, this nation is nothing.